So this month we are sharing about eating disorders and how we could be of assistance to someone who's struggling with that. And there is no better place for you to be than at Inspire Smiles with me, Dr. Gable, because I have personally suffered from eating disorders, actually both anorexia and bulimia in high school, as well as our eldest daughter has she's almost died from it too. So it's something that is very dear to our hearts. We definitely get you, and it is something that you can feel comfortable with coming to our practice. I definitely identify and understand what you're going through, so you won't be shamed, you won't be judged, you'll be welcome, loved, and as a dentist, I do know what we could do about a smile that's ruined by that. So personally, when I first moved to the United States as a high school student, I was on a track and cross-country team, and it's just something that I think a lot of times people think that it's related to food, but it really is not so much related to food. It's actually more related to a sense of lack of control in your life. It's mostly women, but sometimes men also have this just sense of, needing to control something, and food is the easiest thing that we control, or at least it seems like it. So that is something that in high school happened to me, where I was just significantly malnourished, thinking that I needed to be thin, I needed to be fast, I needed to do a good job at school. I also wanted to be an athlete and perform well athletically. So I had all kinds of systemic effects from that, from my monthly cycles stopping completely for over a year, just looking really, really thin, and my hair falling out. And I totally get what you're going through with that. And I also understand and know what to look for in the mouth as signs and symptoms of malnutrition or anorexia or eating disorder related changes in the mouth and the teeth. Eating disorders, besides anorexia, there's also bulimia, and that one probably affects the mouth the most because there's actually stomach acid coming out against the teeth, and that is something that, again, I have also struggled with. So I definitely get what it's like. I definitely get what it means to be, in those times where you are eating all the things that you shouldn't, or just kind of binging and doing things like to overdo it, and then going to the bathroom and throwing it up. So I recall multiple times of myself on my knees over the toilet crying, just with everything out, and the blood, and just the pain of it, not only physical but emotional and mental, is quite severe and significant. And it does, of course, ruin teeth, and thankfully, I didn't ruin mine, so I was able to recover in time. But I know it does happen a lot where teeth do get ruined. There are multiple things that are quite complicated that we have to take into consideration when we don't have enough enamel, and what we have to do to be able to restore teeth is definitely a lot different than someone with healthy levels and amounts of enamel. So again, you're welcome here, you're loved, and we can get your smile in the perfect, awesome shape, as well as help you physically, mentally, emotionally, and spiritually. If you're open to it, you will definitely be just accepted as you are, because I know what you're going through. I totally get it.